Okay, so news continues to get worse as far as the overall cases are concerned. And as a result, we've actually seen some reaction right down to Philadelphia shutting down everything until February. But as we reconvene, the two of us, do we have any more information behind the data? That's something that's coming from the past couple of weeks where you're starting to figure out why there was such a large number that continues to grow, or is it something still where we're just not there yet as far as understanding the data?
Uh, you know, uh, let's put it this way. The data is clear that there is an increase in the number of hospital admissions, and we are still waiting to see what happens over the next couple of weeks in terms of hospital deaths. So again, there's a lot of back and forth. There's still a ton of politicizing going along. But if you look at the southern western area of the United States, clearly they're under a surge, and that also puts into question what happens to the places like New York City right now that had a surge a while ago and now are opening slowly. The numbers in New Jersey, which is similar to what's happening in New York, are starting to rise again. Now, they're not rising at the same rate, but that's a concern in terms of where we're going with this particular pandemic.
Yeah, and I think just looking at where we see it even in PA here, numbers are rising, and maybe cities like Philadelphia, New York, and in the extent of North Jersey, they're watching what's happening elsewhere to where maybe it was not sooner, not quick enough to react to the reopening. And now it looks like everything is being tighter in this part of the country.
Yeah, no, I can't say more than what you just said about it. It's a concern. I think that United States is not doing well. There's no question about that. But I think that other countries across the globe are not in any shape feeling relief at this point. Just because we're looking bad and they're looking better, I don't think that they're looking for this to be a point of relief for them either. Everyone's very concerned.
Yeah, still. And are we at a point where all the warm weather and the possibility of the summer killing this virus is wishful thinking, or is there still some hope that if maybe it takes more mitigation, extreme measures in mitigation, that the warm weather can help?
The quick one is that we really don't know. So far, this virus is independent of weather. And, the reason we say that is because, some of the southern hemisphere areas that had hot weather before, clearly, again, they still had infections. So, but at the same time, if you look at them now, which is the cold weather in New Zealand, they're pretty free of infection. So I don't know that their weather has a big determinant here.
As far as, and I know it's been reduced to wearing one or not, but are we at a point now where clearly wearing a mask is going to help reduce from you or anyone around you? But it seems like it's not just that, because otherwise we wouldn't see these cases spiking in such large amounts. Not to say that everybody who is positive isn't wearing a mask and that everybody who is maybe asymptomatic is still wearing a mask and not knowing it, but it seems like there are other factors involved here. Otherwise, just doing one thing I would imagine, have lower numbers as a result of it.
No, I think you're right. Again, there are multiple things that need to be done: hand washing, distancing, as well as avoiding crowds, even though you're wearing a mask. Masks have a very limited impact in terms of stopping a pandemic. Masks clearly have more of an impact on a local basis in terms of transmitting it from one to another. You know, I think this is one of the few places in the world, maybe other than Brazil, where there's a debate about wearing a mask or not wearing a mask. The fact of the matter is that anything that can reduce the transmission reduces the transmission, and mask is one of them. To point out to say that it's not 100%, well, that really doesn't alleviate anything, because the fact of the matter, anything that helps should be used, including the mask. So regardless of the political issues and the debates around the mask,
Right.
until we have, we shouldn't be really debating this, because, our country is not doing well. And there should not be a debate about masks and social distancing and avoiding crowds and hand washing. We should all be in it to try to stem this. It's not even a second phase. It's just another phase of this particular pandemic in the United States.
So it looks like, and on that same thought, as far as limiting crowds and interaction with people in crowds, it looks like we have a start here in Philly where they've taken matters back into their own hands and eliminated any really large events, from races to concerts to, I imagine, sporting events now, through at least February, the end of February. Is this now the first domino to fall in which we're going to see, again, large capacity areas reduced down, if at all, allowed to have people in there?
Well, I think you've seen it in Pennsylvania, but you also see it this week in California, where, again, how do you justify to the community that you're opening a place that has a potential of transmitting a deadly disease, that you're doing it because you understand that people are cooped up at home? But how do you explain that to the families who may lose an individual under those circumstances? So again, these rapid opening that have occurred, allowing crowds to congregate, debating the masks, all these yield an infection, which unfortunately still is a pretty bad one and associated with high mortality. So I think that anything that can be done within reason should be done. Now, when I say within reason, what I mean is that if you want to open certain things, you should open them in such a way that does prevent spread of infection, which means, on one hand, the governance of a state may restrict certain openings, but at the other hand, the citizens of the state, if there is an opening, really need to behave responsibly, and I don't see that happening across the board.
Yeah, so at this point, it looks like, at the very least, we're heading down the road of people in charge taking it back into an authoritative standpoint. And if it's quasi-quarantining or full-on quarantining, it looks like we're heading there, as opposed to waiting this out in 2 weeks. It kind of be like, the surge into a distant memory.
Right. You can look at it that way. I guess I'm looking at it from a public health point of view, and that is that if a leader of a state is concerned about the resurgence of infected number of individuals and hospitalizations, they are, besides being the leader and wanting to be reelected and all that, once they're in office, they have a fiduciary responsibility to the community and their constituents. And that really spells out, you have to do whatever you have to do to stop the spread of infection in your locality. That's basically it.
Okay, so one thing I wanted to hit on is the conversation about antibodies and how that is moving forward here, because in my world, there is some belief, at least amongst baseball and baseball players, that somebody coming back from a positive COVID 19 test after quarantining for 10 to 12 days and passing two negative COVID 19 tests in a row, that they are now immune and invincible for a while. And I just don't know, based on our conversations, how long we really know, you and your medical community really know how long these antibodies even last.
Right. So first of all, we don't know. We know one thing, that antibody rise vary from one individual to the other, and we've seen that with the plasma that people donate after they've recovered from the infection, that they have variable, what's called titers, meaning the amount of antibodies in their blood. And also, there is some data showing that, and I think the WHO today released information, whether you believe it or not, that these antibodies that are associated with COVID-19 infection don't last long. So I think that two things. Just because you have antibodies today doesn't really necessarily mean that you're invincible. At the same time, great, if you do have antibodies, the likelihood of you getting a reinfected early is probably low risk. And when I say low risk, I would add a very low risk. But at the same time, you don't know what's going to happen in 6 weeks. In 6 weeks, your antibody titers may be so low that you may be, again, freshly at risk of an infection. Now, you may not be as sick as someone else who gets the infection de novo, but we don't know that. We really don't know that.
Is that being factored in your medical opinion? Is that being factored into decisions being made about how to continue and hopefully successfully mitigate, at the very least, what's going on? Just how little people know about how long antibodies last, because if that's the case, and we don't know if it's going to be a week to 10 days that somebody has it in their body, wouldn't that push even more to have people back in their own houses and shut things down, as opposed to kind of push forward with people's heads down?
So my statement would be that at this point, basing any decision on antibody presence is probably premature. I think that, we don't know, should not be just because we don't know, it doesn't mean that having a presence of antibodies should make you make a one decision, and the absence of antibodies make another decision. We just don't know. And that really is um, not a major concern in terms of the healthcare mindset, because as long as we don't have a proven track of the antibody testing, number one, and two, understand how long these antibodies last, and three, understand how these antibodies actually interact with a new infection. Until that happens, I think our decisions have to be based on the infectivity, meaning it's called universal precautions in medicine, meaning that if you walk into any room where there's an infected person, you have to abide by certain protective measures. And that's where we are. That's your basis right now on how we make decisions in healthcare.